In today's Women's Care Wednesday, we welcome back Dr. Jennifer Gilby, who we're excited to chat with every day. And I love that you kind of shed light on these topics that maybe we've heard about. And this one in particular, we're talking about hormone replacement therapy. We've talked a little bit about it on the show. Maybe you've heard about it again, but who does it help? Let's dive in and talk about the ideal people that might benefit from this.
Women who benefit from hormone replacement therapy are women who obviously don't have their own natural endogenous hormones anymore, either from needing a surgery where their ovaries are removed or from just naturally going through menopause, which the average age is 51 and the range is 46 to 56. So women typically come to us with symptoms, and it's the symptomatic woman that really needs hormone replacement therapy.
Well, you know, I've got to ask about those symptoms now.
Right. So hot flashes, night sweats, insomnia, mood swings, foggy thinking, it can affect libido, multitudes of different aspects of the body can be affected during menopause, but they come saying, I can't function.
Yeah.
Give me something. What's going to help me? And so we want to start women soon after menopause and try to, not start women after the age of 60. They run just more risks in that. We do start them. They have to be counseled, to understand the risks.
I was going to say, and I think sometimes you do hear the risks. So let's talk about actually how the process works, how you're able to administer these hormones and what people need to keep in mind.
So there's multitudes of forms of hormone replacement therapy. There's patches and creams and sprays and gels and rings and pellets and pills. And so we really talk to the patient about what's going to be best for you. What are you going to remember to do? What are you going to be comfortable doing? And we try to tailor it for what their needs. Estrogen is the main component that relieves women of the majority of their symptoms. Progesterone is a necessary component if they still have a uterus, because it prevents thickening of the endometrium of the uterus, and which can lead to endometrial cancer.
And that's one of the things that sometimes you hear. So I like that you already have an answer to, like, sometimes people talk about those risks.
Right. So the risks really run in the combination therapy. So estrogen, progesterone in the studies has shown to have the increased risks. Estrogen alone does not have the same risks, which is interesting. But the risks are cardiovascular events, so stroke, blood clot, heart attack, and there's an increased risk also of breast cancer. But it's 2.5 to 3 per 1,000 women that can be affected by that. So it is a small number.
And I'm glad you say it's a small number. And I really like how at Women's Care Florida you do the education. You get to know these patients so that you can monitor. What's the feedback, though, after they start using some of these replacement hormones and maybe the symptoms decrease? You've got to hear that in your office,
absolutely.
too.
I mean, I tell people, they're like, well, what's going to help me the most? I said, the minute you take estrogen, your symptoms will go away. It's not going to matter really what form you take. So believe me, you'll feel better almost immediately. And they do. They come back and they're so happy. I mean, they do not stop coming for their hormones. Once they get relief and they feel better and back to their normal self, they're much happier.
I think it seems like when women do get into that age group, it's all something we're like, am I going to do it? Am I not going to do it? See how bad the symptoms are. What do you hear from your patients most regarding this that you would like to educate other people out there about?
Well, I think that my speech to my patients is your everyday quality of life is important. And if you're not sleeping, you can't think straight, and you're irritable, what quality of life is that? And unfortunately, we can't say how long those symptoms are going to last for them. We don't know. I mean, they can go on and on and on for some people, and they can be very short-lived for others. So, I just counsel them about the risks, counsel them about the benefits, and try to encourage them to make a decision that's going to make them feel better. And I tell them, even if you just do 5 years after menopause, that's really where the studies don't show much increased risk at all. And they get you through that, over that hump, and into a place where you're not going to have the symptoms and you can stop. And patients who come to me with no symptoms, I say, you shouldn't start. You don't have a reason to take it just because.
Well, maybe you have the symptoms, or maybe you want to know more information. Again, I think education with this is just key. So I know that you do that with your patients. Of course, you can contact Women's Care Florida. You can, of course, contact our wonderful Dr. Jennifer Gilby as well. There's the website. As always, we do appreciate your time today.
Thank you for having me.